intervention is the implementation of the intervention. Essentially, it has three components. Number one is that you have to have scientific proof, some way that there's a documentation that this intervention controls your hazard.
Right.
And that's the basis for you deciding to put that intervention in your plant. The second component of that is the in-plant validation. That you have to do the documentation, you have to do the work that shows that you can make that work in your hand, right? The third component is that pathogen actually has to see, the intervention has to see the pathogen, right? So that's where contact comes in. So those two have to come in contact to make sure the intervention is effective. So regardless of how good the intervention is, if the intervention does not see the pathogen, it's not going to do you any good, right? So there's a number of failures in that system. It's not as wide as I tend to make it, but I just do that again to get people's attention.
Right.
So one of them is address. If your slaughter facility will be dressing issues. If you have so-called what we call the deep cuts and folds and flaps, or places that pathogen can hide, intervention cannot see it, then that's going to create a problem for you. That's a hole in your system. So we tell people to make the carcass surface as smooth as possible before you go to your final set of interventions. Okay?
Right.
But for intervention to even see that, it has to have, the delivery ought to be appropriate. Nozzles, you know what I mean? So nozzles, if the nozzles are plugged, they will not get there. If the nozzles are not oriented properly, they will not get there. Then the other one is the critical parameters, which will be the concentration if it's acid, temperature if it's hot water, and that sort of stuff.
What are the operators most likely to forget about or overlook or ignore?
Just not check periodically, because if they check, they should have a list. When you do in-plant validation, right now, just good to pause and say we've come, miles and miles and miles compared to even a year ago. So when you do validation studies, you come up with a series of critical operating parameters that in order for the intervention to work, it's got to have those operating parameters. So that operating parameter, a QC has to have a list of those for every intervention and check that routinely. That's their responsibility throughout the day.
Okay.
So that would be, temperature, pH, exposure time, or dwell time we call it. So they just have to do that routinely just because it's got to work throughout the day.
It seems that for plant operators and the plant personnel that the idea of the validation is something that they're still trying to get their arms around. Most of them have done it, but some of them are still trying to get their arms around it. So there was, not having the parameters. Then there was having the parameters and not measuring them. Exactly. And then the third one was having the parameters, measuring them, and then ignoring the results.
Ignoring them, exactly.
And are those just examples, or is one of those categories sort of more common than the others?
I think those are all examples, and Dr. Peterson, those are the issues that he had seen during FSA. Undoubtedly, that stuff will happen, and that's why actually FSAs are good, because people learn a lot about their process and that sort of stuff that they'll correct on a long-term basis. But all of those are examples, and certainly it's not a one place that stuff happens. There are a number of other places that happens. And a lot of times they don't do validation. They read a scientific paper, they sell them, use lactic acid, but they don't follow the parameters of the study. I think it's doing in-plant validation is invaluable. I didn't think, believe me, as I mentioned this morning, I set out to prove USDA wrong, and I was proven wrong, because there's tremendous amount of variation in implementation.
And that was a big surprise to you?
It was a surprise to me, yes, because I figure hot water is hot water. But as one of my USDA colleagues says, when you put hot water cabinet in 400 plants, surely they're not going to get implemented the same, and he was correct.